How's that, Jay? afternoon, Rhode Island. I want to thank everybody for tuning in this afternoon, 1 o'clock on Wednesday. It's great to be with the members of the press and to be with all of you at home. I would ask you to continue to tune in Wednesdays at 1 o'clock. We have a ton of information every Wednesday. We're trying to keep everything to 1 day a week. And so I would ask you please to tune in every Wednesday and get the word out to your friends. If you can't, please sign up for a daily email at governor.ri.gov. Get an email every day, and also on Saturday, a refresh for the entire week. Before we talk about coronavirus, I just want to take a minute to acknowledge the fact that we had a pretty quick yet serious and disruptive storm yesterday afternoon. In fact, I just, a bit late today, and I apologize. I've just been out and about surveying some of the damage and talking to folks who have had damage to their homes or their cars. I want to thank Director Mark Pappas for doing a good job managing this. He and his team, my team, we've been in touch constantly with National Grid throughout the night and all this morning. To those of you that are still without power, hang in there. I'm sorry. That would include my family who are at home without power. This is a serious storm. It came and went quickly, but knocked out over 150,000 Rhode Islanders from having power. To put that in perspective for you, that's more than Superstorm Sandy some years back. So we went from having 150,000 people without power to right now about 70,000 Rhode Islanders are still without power. I want you to know we are pushing grid as hard as possible to get everybody back up as quickly as possible. And they're working hard. They have lots of trucks here. They're well resourced. We expect 2/3 of Rhode Islanders will be back online with power by this time tomorrow, if not before. So I'm sorry for the inconvenience. We are doing everything we know how to do. And if you need help, call the governor's office, call National Grid. We're all going to do everything we can to get you back up as quickly as possible. At this point, every area with a hospital or nursing home or critical infrastructure is back online. That's been prioritized. Okay, so now we'll switch over to the other disaster that we're managing, which is coronavirus. And we'll begin, as we always do, with the data. And I'd ask you please to put the data on the screen. Yesterday, we had 84 new cases. So that's certainly better than the triple-digit days we've been having. 84 new cases, and very sadly, another death. We continue to lose people. We've lost well over 1,000 Rhode Islanders during this pandemic. And so it's a reminder every day to every one of us, let's not get lazy. Let's not get lazy. Let's keep our groups small, wear our masks, because we've lost far too many Rhode Islanders to this crisis, and we have to continue to do better. All right, as many of you have seen, as of yesterday, several of our neighboring states put travel restrictions on citizens of Rhode Island. So I'm sure you've seen this. If you haven't, I'd encourage you to learn more about it if you plan to travel. If you go to Connecticut, New York, or New Jersey for more than 24 hours, they will ask you to quarantine there for 14 days. If you go to Massachusetts, you need to quarantine for 14 days or provide proof of a negative COVID test within 72 hours before you go. These states all have their own rules. You should, if you're planning to go there, you need to check out those rules. This doesn't apply if you're going for work. This does not apply for commuters. It doesn't apply if you're seeking medical care. It doesn't apply if you're an essential worker. But I would say this is new news. It's starting today. And if you're planning to go to Connecticut, New York, New Jersey for more than 24 hours, it applies. If you're planning to go to Massachusetts, it applies. And Dr. Alexander Scott is going to focus her time today going through why that's happening and the numbers around prevalence there and prevalence here. Here's what I think about it. On the one hand, I think it's a good thing. It should certainly be a wake-up call for the people of Rhode Island that we need to do better. Our numbers are creeping up. There's no doubt about it. And we could be doing better with our social distancing and mask wearing. This is also a good thing because the less we're all traveling, the better. And I think these restrictions, they're going to mean fewer people obviously coming to Rhode Island. If you're, from another place, you're not going to want to come to Rhode Island to use our facilities because you'll have to quarantine when you go home. So that is a good thing. It'd be fewer people coming to Rhode Island and fewer of us traveling. Staying close to home is still the name of the game while we're fighting the virus. And that is, I think will help us fight the virus here in Rhode Island. As I say, on the other hand, this means we have to pay attention. I have been up here for weeks asking us to keep our groups small, putting the social gathering limit from 25 to 15, warning that there would be consequences. There's no way around it. As I've said so many times, you cannot fight the virus. It's not going away. We can't hope to trick it. It's here. If we don't follow the rules, things like this will happen. And this will hurt our economy a bit, for folks who are maybe thinking of coming from Massachusetts to one of our fabulous restaurants in Providence, they will think twice now, and that's a shame. And so the rest of us have to get more serious. I will say this, it's not cause for alarm. And we're going to go through the data, and the doctor will go through the data. Our percent positive rate here in Rhode Island is still below 3%. We've still tested more people per capita than anywhere in the country. We still are in good place with our hospitalizations, and we're still below 3% test positive, which is where we've been for weeks. So I'm not here telling you to panic, but I am saying this. We are at a turning point right now. We want to get children back to school. We want to get folks who are out of work back to work. We want to make sure that our hotels and restaurants and such can be operating and people can get back to work. We're teetering right now. We were at a very fragile place. If I had gotten up here today and said we had 115 cases yesterday instead of 84, that would not be a good thing. So we have a choice right now. This is a turning point right now. We need to clamp down ourselves and get more serious. And I'm going to go through a handful of new restrictions that we're putting in place. These are the next step. If we don't start to follow these new rules, then probably next week I'll be back with much more restrictive rules, just like you're seeing everywhere else. Can't go to the beach in Florida, can't go to the water park in Arizona. I don't want to have to do that, but if we don't all start trying harder, that is definitely where we will be going very soon. Not because I want to, but because we will have to. And you're seeing it today already. Massachusetts, Connecticut, New York, New Jersey are saying Rhode Island needs to get a bit more serious. Let me say a few things. I know there are some people who were planning to go away, this weekend or next week. Hey, Governor, I've already rented a house in the Cape for next week. I've already spent a lot of money for a hotel in Nantucket. Some people were planning to go away to see their family in New York. So we are, as of this afternoon, I want to help you out. I'm sorry that this is inconvenient. So starting this afternoon, we're going to make it easier for you to get a rapid test so that your vacation plans or travel plans for next week won't get disrupted. Beginning this afternoon, you can go to portal.ri.gov, and there'll be a new special place that says planning to travel to another state. If you click on that, you can get yourself tested. We're setting up a site at the convention center. We have a site at the convention center, and we'll work as hard as we can to get you your results within 24 to 48 hours. So if you're listening to me now, you're anxious about plans for next week, this afternoon, go to portal.ri.gov, go to the section that says traveling to another state, sign up quickly, go to the convention center, get yourself tested, and we'll We'll try hard, and I believe we'll be successful to get you results within a day or two. For the rest of us, look, I've been asked many times at this press conference, can we do more for small businesses? Can we pass out more aid? And the answer is we're trying and we want to do that. The best thing I can do for small businesses is to keep them in business and to get them back in business, which means the best thing that all the rest of us can do is follow the rules. It's getting very frustrating that people who aren't, the small percent of folks not following the rules are really going to ruin things for everyone else, for the kids who want to go to school, for folks who want to go to work, for people who want to go visit mom and dad in nursing homes. So I'm asking you to, let's go back. Let's remember how we all came together in March and April and May. Let's get that spirit back. This is a turning point now. It's on us. And I think if we come together and really restrain ourselves, we will be just fine. As I say, this isn't an emergency at all. We're less than 3% test positive. It's a turning point. And I think we have it in us. Have some Rhode Island pride. I do not like seeing us in red on that map. Have some pride in ourselves and our response, and let's make it our business to do the right thing. We also are going to be ramping up enforcement of our own out-of-state quarantine order. Last week, going through our new cases, more than 11% of our cases trace back to out-of-state travel. So we are obviously have to get a lot more serious about stopping these cases from coming into Rhode Island. I want to take this occasion to remind you, anyone coming to Rhode Island from one of the 33 states around the country with a percent positive rate of greater than 5%, or any Rhode Islander who travels to one of those places, must quarantine for 14 days or present a valid negative test from within 72 hours. And I'd ask you please to put the list of those states up on the screen. You can see that list on the screen. It's constantly refreshed at the Department of Health's website, constantly refreshed at reopeningri.com. If you're planning any kind of travel, check it out, please. We're going to have to follow the rules. This, I want to be clear, that applies to Rhode Islanders who visit these states for non-work related purposes. Now, we're also going to get a little bit stricter on enforcement. Beginning this Sunday, anyone from those states on your screen who checks into a hotel or a beach rental property or any kind of a rental property is going to need to sign a certificate of compliance verifying that they have had a negative test result or that they intend to quarantine for 14 days while they are here. If they do not do that, they will not be able to stay in Rhode Island. So, in other words, if you try to check into a hotel, try to check into a B&B, try to check into your beach house rental, and you don't have, and you're from one of these 33 states, and you don't have proof of a negative test within 72 hours, these hotels will have to turn you away. We're going to be requiring hotels and rental companies explain the requirement in advance before folks show up, when customers first call or click to make the reservation. This approach is very similar to what they're doing in Maine. We've been in touch with the folks in Maine. It's working very well there. They're very strict about it, and I think it shows in their results. So we're going to learn from a successful strategy, and we're going to put that in place here. We're working with the hospitality industry and with individual businesses to communicate this new change, which will go into effect Sunday. We're also going to be deploying members of the National Guard and the Department of Health at the airport and at the train station, passing out information to anyone who's traveling here, reminding them of our rules, seeing if they have proof of a negative test. And we're also going to be increasing at the airport and train stations and increasing signage at the airport and train stations. So again, we want to open school, we want to open businesses, we want to stay in the safe place that we are. So we have decided to take this additional step to clamp down on out-of-town visitors. We want you to come and stay here, but you have to follow the rules. And I want to thank the hospitality industry in advance for your cooperation. We've been in touch with many of you. Commerce will be in touch with you over the next few days. We'll do everything we can to make it easier for you, but we are going to require you to enforce this, and if not, there will be penalties. Okay, I want to talk for a minute about bars. I've been up here week after week after week talking about bars. As we continue to go through the data, we continue to see that bars are a problem. We know that, as I explained, many of our test positives are related to someone coming from another state. The same is true for bars, people congregating at a bar. You see it clearly in the data. Also, bars are doing okay, not great, at enforcing the rules. This past weekend, our inspectors found 20% of bars were still not separating the bartender from the customer. That's totally unacceptable. We've been at this for months. The rule is crystal clear. I could understand 1%, 2%, 5%, 20%. We have been bending over backwards to keep the bars open. You know, parts of restaurants, bars can't operate as bars, because I am very sympathetic to the fact that restaurants are barely making it. Having said that, the data is clear, the data is in, we have a problem, and we need to get it under control. So there are many voices saying, shut down all bars, all bar areas. And I won't hesitate for a minute to do that if in a week from now, we're not seeing more improvements. For now, I'm taking a middle of the road approach. Starting Friday, no bar areas in the state of Rhode Island will be allowed to be open after 11 o'clock at night. No bars allowed to operate past 11 o'clock at night starting this Friday. Restaurants that have a bar can stay open. They can serve drinks with dinner to the table, but the bar area must be closed. We are going to be out in force enforcing this. We are going to very much ramp up our inspection over the weekend and next week. And I unfortunately will have to close bars, the operating part of a bar, if we don't get better compliance with congregating. I don't know how else to say it. I have been trying week after week to avoid this and to strike a balance so folks can stay in business. There's just too great of a percent of restaurants and bars that are pushing the limits, trying to skirt around the limits. It's pretty clear. You cannot have people congregating in your bar area. I don't know how to make it any clearer. And the fact that you're continuing to do that is making it harder to get kids back to school. It's making Massachusetts, Connecticut, New York, and New Jersey say, Rhode Island, you better clamp down a little bit. So starting Friday, 11 o'clock, no bars after 11 o'clock. And as of tomorrow, on Reopening RI, Commerce will have all the details around exactly how we'll enforce it, what will be the penalty, and what your bar area should look like. But it's essentially going to have to be a closed bar area and probably roped off so there can be no congregating. I've also been talking about social gatherings. We are struggling to keep social gatherings under control. So I want to remind everybody that the limit is 15. We went from 25 last week to 15. If you hadn't heard that news, I hope you hear it now. 15 is the social gathering limit. You shouldn't be at a party with 20 people. You shouldn't have a baby shower with 25 people. You shouldn't have a pool party or a family gathering with dozens of people. 15 is the limit. I also want to say it should be the same 15 people. It shouldn't be 15 friends on Monday and a different 10 friends on Tuesday and a different pool party with 6 different friends on a Wednesday. We have to go back to where we were in April, May, getting really serious about this. Pull out that contact tracing notebook, dust it off, and let's get back at it. I know it's a pain. I wish there were a different way around it, but this is a brutal reality. So figure out who your 15 people are going to be. I'd ask you, please, right now, today, tonight, write down who your 15 people are going to be. It's your family, coworkers, couple of friends. Stick to that group, please. And use your contact tracing notebook, because you just want to keep track and make sure that in the course of a given week, you're near about 15 people. And please wear your masks. I cannot emphasize it enough. It's such a simple thing. It's hard to believe that such a simple intervention could be so powerful, except it is. And it only works if everyone does it. So if you know you're going to be close to someone for a period of time, your masks. I cannot emphasize it enough. It's such a simple thing. It's hard to believe that such a simple intervention could be so powerful, except it is. And it only works if everyone does it. So if you know you're going to be close to someone for a period of time, So this weekend, if you want to do your, civic duty and you see something happening that makes you nervous because there's too many people too close without masks, please call that number and let us know so we can try to deal with it. We will deal with it. State police will work with local law enforcement, will work with DBR, will work with DEM and decide the best way to go about it, who should go out, who should make a visit. But we are getting very serious about this. Our goal is always educate first. From the beginning, we want to make it easy. If you don't have a mask, we're not fining you for not having a mask. We're giving you a mask. We want to make it easy and de-escalate the situation. Having said that, I want to remind you the fine for violating a social gathering limit is up to $500. That means if you are at a party and there's 25 people, all close, no masks, every one of you could be fined $500. So I wouldn't take that risk because it's not the right thing to do, and we are going to start enforcing this. To every mayor in Rhode Island, I'm talking to the mayors later today. We need the mayor's help as well. Mayors are on the front lines of this. They're doing a good job. But we're going to be asking the mayors to really increase, to have physical presence, and we're going to try to help them to do that. Mayors and local community organizations know folks in the community, and so we're going to be working very closely with cities and towns, just to maybe it's a volunteer effort, just increase physical presence out and about so we can reduce crowds. I also would like to encourage everybody to stay outside. We want to keep our social gatherings small, so 15 is the number, but we also know outdoors is safer than indoors. In general, thank God, the weather is good, so please take advantage of being outside. Work outside if you can, eat outside if you can. So many restaurants have gotten so creative. I'm so impressed with every one of you by pushing tables outside in every possible creative way. Thank you, thank you, thank you for rolling with it. But to everybody, just be mindful. It's a good opportunity to stay outside. Okay, I want to talk about testing, and in this regard, I have some good news. In addition to the spikes that we've been seeing recently in Rhode Island associated with large social gathering, the reality is delays in our testing results have also caused us problems. It's hard to do contact tracing if it takes 6 or 7 days to get a test result. And this isn't unique to Rhode Island. This is a fierce fight for resources all around the country. And we're in it. I'm in that fight for Rhode Island, but every state is struggling for limited resources to get more testing supply. And the thing is, as states are testing more, commercial labs are overrun. And sometimes it takes as much as a week or more to get your test result, which is totally unacceptable. And we will not rest until we fix that problem. So on that front, I have some good news. After a couple of weeks of scouring the world for more testing supply and a competitive bidding process, we last week were able to contract with 2 new labs, AccuReference and Dominion Diagnostics. Dominion is a local company here in Rhode Island, so that's always a win-win when we can help Rhode Islanders and put Rhode Islanders to work. The combination of these 2 additional labs are going to massively expand our testing capacity and, importantly, guarantee everyone gets a result within 48 hours. Starting next week, AccuReference and Dominion will each run 1,000 Rhode Island tests per day. So 2,000 additional tests per day with a guaranteed turnaround time of 48 hours. By next month, Dominion will increase their capacity to 7,000 tests a day, 48-hour turnaround time. So that'll bring us up to 9,000 tests per day. If you include AccuReference, Dominion, the state lab, and a couple of other private labs. I personally called the CEOs last week. I said, you better guarantee this is 48 hours. They have guaranteed it. It's in the contract. This is a big win. So hopefully in a week from now, we'll be in better shape on testing, and then it's gonna ramp for there. I have been talking to many teachers, parents, students. Testing within 48 hours is key. It's a key piece of the puzzle if we're gonna get kids back to school safely. And so I want you to know I'm increasingly confident we're gonna be able to hit that goal. And to all of you who've been patient, waiting 6-7 days for your test result, I'm sorry about that. And starting next week, it's gonna start to get a lot better. It also, I believe, is gonna help our overall spread, because the quicker we know if someone's positive, we get in touch with all their contacts, put everyone into isolation. It'll, I think, really help us keep a lid on the virus. So to that end, I want to keep pushing testing. If you feel sick, even a little bit, if you're in a close in contact business and you don't feel sick, please go get tested. We need more folks tested. If you're positive, we need you isolated quickly. Starting today, we're expanding our asymptomatic testing to every Rhode Islander between 18 and 39 years old. So beginning tonight, if you're in that age group, 18 to 39, please go to portal.ri.gov and sign up for a test. It's free. This is a new initiative at Dr. Alexander Scott's urging. We know we're having more troubles with young people. We know they're the ones who are in more parties, more social gatherings, out later at bars. So we're saying we want you to get tested. And also, we know not enough people in that age category are getting tested. So please consider doing it. It won't take long. Portal.ri.gov, between 18 and 39. If you're asymptomatic, you don't have to feel sick. We just want to know what's going on in that population of young people. Please go get tested, and it is free. I do want to say this. Just because you get tested and it's negative doesn't mean you can throw caution to the wind. You still have to follow all the other rules, but we want to test many people in this age group so we have a feel for what's going on in that age group. I want to make a plug for you to download and use your Crush COVID app. We're up to more than 70,000 Rhode Islanders, so thank you to the 70,000 of you who've done it. You can go to the Apple App Store or Google Play, We have a new version. I use it. I like it. It's useful. This one doesn't drain your battery as much, so please use it. This isn't going to be forever. This is for right now. This is super helpful, and I would ask everyone to please do it. Okay, I want to spend the last few minutes talking about schools. Last week, I outlined the different metrics and benchmarks that we're tracking as we think about whether it's safe for children to go back to school and under what conditions, full in-person, fully at home, some kind of a hybrid. And I'd ask you to please put that slide up on the screen as a reminder to everyone. There are 5 key areas that we are focused on as we determine the best thing to do for school. Number 1 is statewide data. We want to make sure as a state we're still in phase 3. Another is municipal data. This is going to be different town by town. Testing, and I just gave an update on that. I think we're going to be in a very good place on testing. Supplies, which is PPE, and operational readiness, which is mainly facilities. A lot of school buildings are very old, and they're having to make accommodations to expand the building, and so they're working on facilities. They also have to ensure that they can be cleaned adequately every day. And as I've said, this is very clear. These are the 5 benchmarks so that we know it'll be safe. If we don't meet the hurdles, we won't open. I believe we can, and we're going to push to get there. And I want everyone to feel confident that if we say school's open, it's because we passed the test. Today, I want to talk for a minute about the second metric, which is the municipal case incidence rate. Not every community is the same. We know that. So what's safe in one place is not necessarily safe in another place. Case incidence is typically measured as the number of new cases per 100,000 residents. And based on, last week I explained that we've compiled a team of experts to advise us on school opening. And based on the input of that advisory team of health experts and extensive data analysis, consultation with the CDC and other states, we've determined that municipalities must have a weekly case incidence rate of fewer than 100 new cases per 100,000 people in a week in order to fully reopen their schools for in-person learning. So it's 100 cases, 100 new cases a week per 100,000 people in the town. In order to fully, you have to be below that in order to fully reopen schools for in-person learning. So if in the previous week a city or town had more than 1 new case for every 1,000 residents, then they'll need to go with one of their more limited reopening options and not the full in-person return. So if today we're August 31st, what would that mean? That would mean that 3 municipalities could not open full in person. Those would be Central Falls, Pawtucket, and Providence. Based on last week's data, per 100,000 residents, Central Falls had 186 cases, so well above 100. Pawtucket is at 135, and Providence is just above it at 103. So each of these cities would instead move to a partial reopening plan instead of the full in-person. The rest of the state would be cleared for full in-person. All of the reopening plans are posted at backtoschoolri.com, backtoschoolri.com. So if you're living in Providence and you're wondering what the partial reopening would look like, go to that website and it'll explain in detail how they're thinking of doing the partial reopening. We're going to make our final announcements the week of August 16th based on the previous week's data. It is my hope that, certainly with the case of Providence, that we would be able to get you back to school, which is why we're up here saying we're enforcing social distancing, we're enforcing social gatherings, we're enforcing out-of-town visitors, we're enforcing mask wearing, and we're improving our test result time. We have a little spike now. We don't want it to get out of control. We want to turn it the other way while we still can without locking down our economy again. So these are the 3 cities, and we're all going to be working hard, hoping to get them under 100. The Department of Education is working day in and day out with each city and town to prepare their opening plans. There's been a mix. Some towns have been fantastic. Others have work to do. And I'd encourage you to do that hard work. I want to commend Tiverton, Smithfield, Scituate, and Middletown. They've done a fantastic job with their plans, their creativity. I'd encourage every Rhode Islander to go online and look at those, Tiverton, Smithfield, Scituate, and Middletown. Again, it's at Back to School RI. They have excellent plans for full in-person learning in a way that's safe. They include provisions like live streaming from classrooms for students who have to stay home to attend virtually. They have special initiatives that emphasize social and emotional learning as well as academic learning, and they've really leaned into surmounting all of the many challenges that are going to exist for schools this year. So thank you to all of you for working hard, and a special thank you to you folks who put forward such a fantastic plan. As I've said, and I'll say it again, we're not going to force any parent to send their child to school. It's parental choice. Our job is to make it safe for them to go to school. If your child is sick, has an underlying health condition, doesn't feel comfortable to go in person right away, every school will have distance learning options, and you will not be forced to go. But I hope that over the next few weeks, we can work with cities and towns so they have robust in-person plans and robust distance learning plans so that we are ready for whatever coronavirus throws at us and our children don't continue to suffer. Kids are getting behind. Kids learn best in school. So we owe it to these kids to make sure we are ready for high quality learning in any scenario. And to those of you who wish we could make these announcements sooner, I do too. The reality is things change every day. So right now we're planning, we're working for the best, planning for the worst, and we'll make final decisions August 16th. Okay, with that, I'm going to turn it over to Commissioner of Education and then Dr. Alexander Scott.
Thank you, Governor. The 3 districts that the governor mentioned, Providence, Central Falls, and Pawtucket, we've been working very closely to ensure that their plans are reflective of where they would be if we made that decision today, and that those plans are really solid and tight. As the governor said, we have seen different types of plans, but some of the plans that also stand out in addition to what the governor said are plans like Little Compton, who has a tent that's going to be outside for different opportunities for lunch to get fresh air. ICS also is using a tent so that they can be outside and have some of the instruction. So there's a lot of creativity that has emerged and a lot of working together and towns working together to ensure that we can provide what the families need, because as you heard last week, parents will have the choice. And that means that the districts need to provide those opportunities. Districts are sending out surveys. If you have not received, please communicate with your districts. Part of the plans is communication with the community. That has been front and center, and we want to be responsive as we move forward. I think the most important part is the numbers and right supporting the superintendents as we move forward. I think that we have seen that the plans are up. Some of them are still draft, and we're going back and forth. This is hard, right? I know that a lot of people say, well, what about this one? Which one needed more work? This is about getting it right, not about meeting these deadlines, but really making sure that we're in a good place so that if you choose to send your student back, your child back, that you feel comfortable with what's happening in the schools. So I think that we're here, we're listening, and it is really your choice. And we're going to give you as much information as possible to make sure that you understand why decisions are being made and why and how it will be enacted and carried out. We've heard you loud and clearly about A days and B days being difficult. So we've given that feedback, and hopefully we'll continue to work. And I think the name of the game as we move forward is flexibility. We have a lot of plans in place, and the numbers will dictate how we move forward. So I want to thank you, and I want to thank the team at RIDE and the Department of Health working every single night to make this possible, and all the superintendents and principals and the parents for the patience and contributing to the solutions. Thank you.
Thank you, Commissioner. Thank you, Governor. Thank all of you for being with us today. I want to recognize Commissioner Infante Green and her team at the Rhode Island Department of Health and everyone at the state level and the city and town levels who have been working so hard to make sure that our approach to schools is as healthy and safe as possible. For our part, one of the projects we've been working hard on at the Rhode Island Department of Health in supporting this effort is to create a COVID management protocol guide for schools. This will be a guide that schools will be able to use when thinking about how to prevent cases among students and staff, and how to work with RIDO should a case be identified through testing. We intend to keep this an extremely close partnership in supporting education in the schools going forward. It really elevates the concept that as a state, we want to keep our eyes on the prize. The best support for our economy, for our society, for our children is getting our schools back and going. That's what we want to do, and that's why our discussions that the governor has shared today are in place to help us really stay focused on getting our numbers controlled, keeping them that way so that we can move forward as a society. Shifting gears as I usually do, I'll give an overview of our data. As the governor said, we have 84 new cases to report today. There has been some variance in our number of new cases since I was here last week. And it's important to pay attention to that because it's a key driver for the decisions that we're making. As the governor said, we are at a turning point. We had a day with our number of new cases in the 50s. We had some days in the 70s, in the 80s, and we have had days above 100 with case numbers around 120, even up to 130. Because of that, we want to make sure we're doing everything we can at this turning point to keep our numbers controlled. This is the moment where we have that opportunity to do that. To keep going forward on the data, we have our fatality numbers that have been somewhat lower over the past week, which is good. In the past week, we have had 3 days with no new COVID-19 associated fatalities. However, there are days when we do have new fatalities to report, like today, as the governor shared. We have 1 new COVID-19 associated fatality, and this person, sadly, was in their 80s. Our sympathies and our prayers are with this person's family and with all the families of those Rhode Islanders who we have lost. As I did last week and want to make sure we continue to do each week going forward, I'm going to give you an overview of what we are seeing in our case investigations. This way you have a clear understanding of the new cases we're seeing as we're studying them. That directly informs the types of interventions that we're talking about and that we know need to occur to keep our cases under control. There are a few common threads that we are seeing. One is related to travel. In the last week, roughly 12% of our positive cases reported recent travel. That has included travel to places like Florida, regional travel in the Northeast, and travel to the Midwest. As the governor also shared, Massachusetts and Connecticut and the other states in the region have put a travel restriction on Rhode Island. That's another way to make sure that we wake up and see where we are, particularly compared to the other states in our region, so that everyone continues to take this seriously. To share a little bit more about the differences in data that the governor had mentioned, one of the biggest challenges is that we have academic institutions and media organizations that are creating state-by-state comparisons because no organization in the federal government is stepping up to do this work. Thus, our surrounding states are relying on those numbers to determine what needs to happen for their states based on what they're seeing for Rhode Island. One of the issues is because we report numbers of people and tests, our numbers are not being compared accurately to other states that may only be reporting based on tests. This complication does not arise for many other states because they are not making this level of data, both people and tests, available. We are working very closely with the national organizations to help them correct how they are comparing our state data to other state data. Nonetheless, there are increases in our cases, as the governor has shared, and this is a turning point, recognizing that Connecticut, Massachusetts, and other states are seeing it. Another trend we are seeing is too many people are in the age range of 20 to 39, some a little bit younger, some a little bit older, that continue to be a challenge in terms of the cases that we are seeing. It's a critical point for us to work with people in those age ranges to really be able to take responsibility for their actions. We want to focus on keeping the economy going, on getting people back to school. That may mean that certain individuals have to make choices to simply wear their mask. Wearing a mask is the sole activity that all age groups can do and will make a difference. We also want to help people in this age group understand whether or not they might be positive with COVID and not have symptoms. That is part of why we are expanding our sentinel testing for asymptomatic people to those from 18 to 39 years old. If you are someone in that age range or near that age range, and you're going to gatherings and not wearing masks, you're going to parties or locations not wearing masks, you're going to communities where case rates are higher, you are or your friends are, take advantage of this opportunity to go get tested. But remember this, it's helpful if the test is positive, because then we can work with you to make sure that you are isolating appropriately and that your contacts are quarantining appropriately and not continuing to spread transmission of COVID-19. If you are negative, that is just one point in time. It does not mean that you don't have to worry ever again about COVID-19. You could go to the next gathering without wearing a mask that same night or the next day and be exposed and be at risk for yourself or for the loved ones who are around you. So we encourage people to go frequently. You can go as often as you want to go and get tested. Be informed for yourself. That's a way to help you take responsibility for your actions to just wear a mask. If you're in this age bracket, you can sign up for a test at portal.ri.gov starting tonight. And people are telling us that they have been to gatherings such as family birthdays and barbecues or bars. That's where we want to help change behavior. Make sure that you are informed about not going to those places. crowding, and not wearing a mask, because that's exactly how cases are starting to increase. And if we don't make a change now, it would continue. But we have the opportunity now to make a change. Something else we're seeing in our cases is a reluctance in some instances to provide information with contact tracers. When our Department of Health staff call to get information to be able to talk to contact tracers. Please know that the information we collect when doing contact tracing is kept absolutely confidential. Contact tracing, the ability to reach out to the people who have been exposed to someone who is a positive case, is a critical part of our work to prevent the spread of COVID-19. Our increase in turnaround time testing is also going to be critical. So a credit to the additional labs that will be joining with the Rideau State Health Laboratory that has been consistently maintaining the 48-hour turnaround time throughout this. The last important part of what we are seeing in our data is what's been mentioned. It's social gatherings, whether it's social gatherings at the beach, social gatherings at bars, social gatherings in barbecues, backyards, places of worship events. If you are in a crowd without a mask, the risk of transmitting COVID-19 with or without you knowing it is extremely high. One of the final interventions that we are looking to do to help address that is to establish our community outreach reinforcement program. I've mentioned this in the past. We need this to expand statewide, and we need everyone to be involved with us. It's a partnership of all of our state agencies as well as with our municipalities. We need cities and towns to work with us, to support, restaurants to engage. The function we want to achieve is getting out into our communities and making sure that people are wearing masks, making sure that people have information about where they can go to get tested, making sure that everyone knows our social gathering size is 15, and you need to keep your groups stable, not change different groups of people that you're going to. We need each of you to contribute to getting that word out so we can continue to keep our eyes on the prize as a state. We're going to continue to build out this group so we can have more boots on the ground. There will be people in the community providing supplies such as masks and hand sanitizer, as well as giving education, reminding people that their gathering group sizes are too large. We're working hard to make sure that the makeup of this community outreach reinforcement program reflects the makeup of Rhode Island. So we need you, we need municipal leaders, we need faith-based leaders, we need everyone engaged in contributing to this process, getting out, giving out masks, giving out supplies so we can change our norm in Rhode Island together. With that, we'll get started with questions.
Governor, to the travel restriction, did you try to lobby any of the other governors not to do this? Based on what the director said, you guys have a difference of opinion on how the positivity rate is calculated. They're using the Johns Hopkins version. They're comparing apples to apples, and Rhode Island is kind of more in the middle of the pack. But did you try to lobby them or try to do anything to prevent this?
No. They both called me as a courtesy to say, hey, Gov, sorry to do this, rules are the rules. And I said, absolutely, do what you need to do. We are talking to the folks at Johns Hopkins, however, to try to have their list more accurately reflect our data. So that is what we are trying to do. But I'm not going to try to twist the arms of other governors.
What did you think when you saw that, Governor? What did you think when you heard
that we were on the list? I wasn't entirely surprised because, as I've said, we've been inching up we've had a few days of over 100, 113. That's not a good day. If we had consistent days of over 100 cases, that translates to a rate of spread of like 1.4, 1.5. That's not a good place to be. So anyway, I was disappointed, obviously. It's hugely inconvenient for Rhode Islanders. I think it might hurt business a bit. So I'm going to work as hard and as fast as we can to get off the list. I think we can. But as we were just discussing, we're just a hair over. And so I think it's within our reach to be off that list quickly.
Were these new measures in place, particularly the Crush COVID unit, before we were added here in Rhode Island to these travel bans, or is that something that came up after the fact?
Good question. It's something we've been talking for the past week. We've been talking a lot around what can we do? What can we do? It's a balance. You know, I don't want to close businesses again. They're barely getting on their feet, but yet we have to do more. And the data is pretty clear. We're going up, not down. So we've been discussing it. And then that was a tipping point. Yeah, no doubt about it. That when that happened, we said, you know, okay, we have to do even more right away.
Governor, when will you have guidance on fall sports?
This afternoon, I believe, there's going to be some guidance coming out on fall sports. And as I understand it, it's going to be pretty consistent with what we have right now, which is to say, you know, like tennis and cross country, sports that are not contact will be essentially allowed. And then soccer and football, they're going to consider later into this season.
Where will we find that guidance online?
Mr. Block, can you help me? So the Interscholastic League is going to be putting it out this afternoon. And I was going to say, and they have been in close contact with the Department of Health and DEM. So Janet Coyd at DEM is involved with sports, and Dr. Alexander Scott. I think 3 o'clock today coming out with it.
Governor, when I think you said because we're now on this list, that other states would not be so much inclined to come to Rhode Island, and that I think you said, and that's somehow that's a good thing. How is that a good thing, the month of August, that people from other states would hesitate to come to Rhode Island? Maybe I misunderstood.
Well, I think what I was saying, or maybe trying to say, was I don't think that's a good thing. I think it's a bad thing that, like, if you live in, I don't know, Attleboro, you might think twice before coming to a restaurant in Providence.
Right.
And I think that's a bad thing for restaurants in Providence. I think what I was trying to say was it's a good thing in that it's a wake-up call. Like, it's a wake-up call for all of us that we're on these lists, our numbers are trending up, and we have to get serious. But I want to get off the list because I think this will hurt commerce in the ways I just said.
It's just our top industry is tourism. And for the month of August, people are hesitating coming to Rhode Island. But I also just want to follow up. Now, we heard Providence, Pawtucket, and Central Falls school districts. Is that also reflective of where the increase is as far as COVID spiking up? It would seem to correlate.
I'm going to let you answer. I don't think so.
Those 3 communities seem to have higher COVID cases. Is that correct, Doctor?
Yeah, that's
Okay. If that is the answer, if that is in fact the case, we hear about Block Island Ferry, limiting the beaches. You have 3 urban areas. Why is the entire state being punished for the actions of the individuals in those 3 communities?
Because it is not just the actions of the individuals in those communities. It's important to be able to say that cases are increasing throughout the state. What was shared is from an education standpoint, we made a particular cutoff that determines when it's safe to do the full in-person versus having some distance learning. But the increase in cases that we are seeing is by far not just limited to those communities. The increase is occurring across the board. And if we don't make changes now, which is what we're talking about and why we're saying it's critical, there will be more municipalities that would cross the line in terms of being on that list with schools. It's why we want to keep our eyes on the prize. This is not just about activities in one community or another. People are living across the state. People are working across the state. People are engaging in activities where they are not wearing masks appropriately across the state.
It just seems, Doctor, through this, there has been challenges as far as language barriers or people hesitant to be tested because of people in National Guard uniforms. Are those being met, and is that still a challenge in those 3 communities?
That is not still a challenge to that extent. We have done well to set up testing and make sure that it's accessible to people in the communities that need it. For some of those communities, there is more testing done per population of those communities. So people are getting tested and responding. That's nothing to do with what you mentioned. It's about the fact that COVID-19 travels across the state. It doesn't stop in certain communities and not go to others. Where we have in beaches, in bars, social gatherings of people coming together without wearing masks, that's where transmission is occurring.
Governor, when it comes to the schools, basically you're talking about all but 3 communities that you would say should be in a good position to go back to full in-school learning. As we talked about before, though, there's still a lot of pushback from school leaders, and now it seems like increasingly from the teachers. And while the commissioner says, and you've said that you won't force students to go, they're saying, well, are you forcing teachers to go? Are there options for them? Have you made any headway on that? And again, they've cited issues like transportation and the spacing. And can you ease up on some of that stuff if you think they're ready to go back?
Okay. So as I said today, and what we put up on the screen is 5 metrics we're looking at, and only one of them is the incidence rate. So below 100 per 100,000, you get a check mark on that for your community, and you could go back. And all of them, except for 3, cleared that one. But then there's the other 4 metrics that they have to be operationally ready. They have to make sure they can clean properly. We have to make sure everyone can be tested and have the results within 48 hours. So there's other hoops that they have to jump through, and they have the next few weeks to do the hard work to see if they can do that. So for instance, if a school, for whatever reason, is in a community with a low incidence rate, but hasn't done a good enough job getting cleaning supplies and PPE and securing transportation, then RIDE might not be able to sign off on it. So we're just pushing them to do the necessary work, and we want to support them. As it relates to teachers, that's not that different than any other folks, nurses, doctors, truck drivers, social workers have all had to go back to work. It's the responsibility of the employer to make sure the work environment is safe, and the same is true for teachers.
And if I could I know there was the high school sports announcement this afternoon, and maybe this is for Dr. Alexander Scott. Have you noticed any cases stemming from youth sports? A number of youth sports like baseball and softball have been back in action for a while now. Have you had any problems there, and would you be willing to expand to some of those other sports that are now more restricted, like football and soccer?
Because we know how COVID is transmitted, when you have groups of people together without a mask, the risk for cases can occur. So we want to make sure that the setup and the environment is as safe as possible. We have seen a few cases among some of our sports teams. So it reaffirms the decision to stay consistent with where we have been in terms of sports activities, because if you become more aggressive and increase to further direct contact, it increases the risk of more cases. We have it at a controllable place right now. We would not want it to go beyond that.
Doctor, real quick on the tests that someone would take if they came from out of state. Is it still $100, and would you waive that to try to get more people to take those tests?
We will still work that through. We want to make sure that Rhode Islanders, particularly whether they travel to another state and need a test in advance of going to that state, or if they return, have access to the testing. So the portal for self-scheduling for tests are available for Rhode Islanders. People who are tourists have the setup the way you described just now.
But that's 11% of what we're seeing right now as far as new cases. Is that an issue in your mind that should be addressed where, look, a family comes to Rhode Island 4 people, are they going to spend $400 to get tested on day 1 when they get to Newport? Is that realistic?
Thank you for asking that question. It allows me to clarify that the cases that we've seen that have that 11% are Rhode Islanders who have traveled. The overwhelming majority of them, when we say it's associated with travel, most of them are Rhode Islanders who have traveled. So that's why we want to clearly make sure that Rhode Islanders have access to the testing both before or after they return.
Governor, question. Individual restaurateurs, individual bar owners are already citing the potential impact from the New York State to Connecticut et al. Ban, if you will, as being potentially devastating. Is DBR with perhaps the Department of Revenue and or hospitality groups attempting to quantify the actual dollar amount so far that we've seen from out of state in terms of sales tax and the hospitality taxes? And is there any individual room, since essentially these are standards set by governors to negotiate with these governors in terms of providing a plan forward?
I don't think there's room to negotiate. This was your question. I mean, their position is we have rules and we're going to follow them, and Rhode Island needs to reduce your incidence so we can comply with what they have. As the doctor said, the challenge is there's no one federal standard. That's been the challenge with this crisis from the day one. Each governor is trying to do our best. So Massachusetts is different actually than Connecticut. So anyway, in the absence of federal leadership, we're stuck with where we are. We are working with Johns Hopkins. If we can get that fixed, I think we could get us off the Massachusetts list. Beyond that, what I would say to these bar owners is help us comply. You know, the fact of the matter is there's still a lot of crowds in bars and restaurants. Like if everybody, we are a hair above these metrics. That's why I said this isn't cause for alarm. It's cause for okay, let's get serious. We have to get under the threshold to get back into green. It's within our grasp. We're here below it. So I think the best thing they can do is the best thing we can all do, which is stick to 15, follow the rules for your bar and your restaurant. And I'm hopeful that in a week or two, we'll be out of the red.
I'm just wondering if actual raw statistics, particularly from areas like Newport, Musqueamacet, Westerly, could actually provide to the public the real potential impact for this travel ban, if you will. Because that effectively what these states are doing is applying a vice grip to our tourist areas in southern New England, southern.
Well, that's what I was saying, John. I mean, this isn't, I'm not sure what I said, so I'm glad you gave me a chance to clarify. This is not a good thing, you know, for restaurants in Rhode Island. So we need to, the best thing that we can do is to get out of this red zone as quickly as we can. So we're back in the green so we can travel freely. And I think it's, like I said, we're so close that if everyone gets a little more serious, I think we'll be in good shape very soon. But that's why we're talking about it as a turning point. We got a choice right now. We can go one way or another. We can keep crowding into bars and keeping our social gatherings big and traveling and not getting tested, and then we'll go this way. Or we can clamp down right now, tilt it this way. I think we'll be in green, and I think we'll have plateaued. So it's up. I can't convince the other governors to change their rules. I have to convince Rhode Islanders to follow our rules.
Governor, can you touch on the hotline if you don't mind? So if I'm somewhere and I see 100 people in a backyard, I should call 764-5544. Is that correct?
5554.
5554. And now who mans that hotline?
State police.
State police does?
State police.
Okay. Do they find out, hey, this is John DePietro calling on my neighbor?
So let me get the number right. 764-5554.
Okay.
It's the state police.
Yep.
I assume, in other words, you don't want to be
Let's just think
identified.
There's 100 people over there, I'm here. No, I don't want them to know I'm the one that
Yeah,
them out.
look, they're
Maybe
professionals.
I get invited to the party
They
for whatever
are,
reason.
you maybe because you're a troublemaker. No, I'm just kidding. Look, they're professionals. They deal with this all day long. So they're just going to want to know, where do they have to go?
Okay, so the person having the party, $500 fine, or did you say every person at the party is a fine?
I want to tell you the rules and the law. And as with all rules and law, when the state police shows up, they use their discretion. But they can fine every single person $500
That'd be $5,000.
at a 100-person party. Yes.
Wow. And that-
Don't have a 100-person party in your backyard. It's very simple.
And that goes into effect when?
Now,
Right now.
right now.
Okay. Why isn't this an emergency? I know you're saying this isn't an emergency, but if Block Island, 75% of the people come from out of state or some of our southerns, to me, this is your window to make money. I think this sounds like an emergency.
Well, what I'm saying by not an emergency is our hospitals aren't overflowing.
Oh, Those parameters.
We don't have 200 cases a day.
Yep.
No, this is a big deal.
But it is serious.
Absolutely,
Yes.
it's serious for all these reasons we're talking about.
Yep.
Like, that's why I'm putting in stricter rules, precisely because we're so close. And if we just try a little harder, we will be in very good shape. Also, we've heard from a lot of people saying, we're not sure where to call with the house party.
Okay.
So we wanted to simplify it with one phone call.
Governor, on another subject, if I might, do you have any response to the Census Bureau dialing back its deadline for completing the census?
I don't. I mean, I think it's a reasonable thing to do considering the circumstances. So.
Commissioner Ponte-Green, with regard to the actual physical adaptations that are going to have to be made at the school level, and obviously we're talking a huge range of potential projects. Do you have any sense statewide how many of those plans are actually taking fruition and are actually in the process of being constructed?
An exact number, no, but I know that many of the superintendents that I talked to have already purchased, have reconfigured the classrooms. They've gone so far as measuring each classroom, spacing the desks, sometimes buying desks because we had tables.
Right.
So there's a whole host of things that are happening right now.
But it's in terms of the more troubled schools financially, like Central Falls and Providence, not to pick on them, but is it even possible that they'll be able to implement the necessary physical construction to conduct and process education in time?
Yes, so they have been working on that. They have been working on spreading out, maybe using the high school building, using the middle school building. So there are many different ways of doing this. There isn't one way. And that's why the plans were really important.
Commissioner, I just wanted to ask, the 3 districts that were mentioned that could not open if, schools were opening today, Pawtucket, Providence, Central Falls, those are the kids who are most likely not to have internet or computers or who rely on school lunch. How concerning is it that those districts are the ones who might need in-person learning the most and might not be able to get there?
Well, so our job is to get them there, right? Like, I think that that's our responsibility. And what we're doing is focusing on our efforts. We're looking at the numbers right now today. So what are we going to do to help them get there? What are the extra things? Because I think the part that we keep forgetting with COVID-19 is that it's revealed a lot of the inequities that we already knew were there. But now it's our chance to actually get that right. So how do we look at those districts and provide more and support more and be really laser focused on what they need? So I think that that's giving us the opportunity to do that. And that's our responsibility, right? That's how we move forward.
And Governor, you mentioned that if we don't sort of clamp down this week with some of the new restrictions you announced, there might be even more restrictions next week. And you did mention some other states that have shut down beaches. Can you just give us some insight, maybe to freak people out a little bit and get them to follow the rules into what you're thinking about doing and what the metrics are that need to improve and what will happen if they don't?
Yeah. So let me say this. I try not to freak people out. This was the discussion we just had. For a while, we had a real emergency. Didn't have enough ventilators, didn't have enough hospital rooms. We'll get there again if we don't follow the rules. So we're not there now. If we don't follow the rules, we'll get there again. Don't believe me, that's a fact. Look at Texas. It's just a simple fact, scientific, mathematical fact. Right now, the problem that I worry more about is having to close restaurants and bars, having to say all the kids are distance learning, because that's terrible. It's devastating, and it's unnecessary. So that's why we're saying, okay, what do I have to do to get people to follow the rules? To your question, I can't convince Massachusetts to do something differently. I keep saying, what do I have to do to get Rhode Islanders to follow the most basic rules? Do you know how frustrating it is that there's still so many pool parties and backyard barbecues and wedding showers and just community gatherings of 30 people? Go tell that to the guy in Block Island who's about to lose his business. Like, come on, people. Be a little considerate. How hard is it to wear a mask? How hard is it to stick with 15 people so that those people can have their livelihood? So yes, we would have to consider shutting beaches. We had a long talk about that, trying to avoid it. It's an outlet for people to go. It's by and large safe. We'd have to consider closing or maybe going from 2/3 in restaurants to 1/3 in restaurants. These are the kinds of things that we would have to resort to. And I'm really trying to hold off on that. So now we're just, I don't want to do that because I think that'd be an economic disaster. So I'm saying, okay, bars after 11. We're trying to take very measured steps to take us down just a bit to get this thing back where we were a few weeks ago under control, then everyone could have their businesses.
If I may, why the 11 o'clock time on bars? Is it the old saying, nothing good happens after 11 o'clock or midnight, or is it that people are done eating, or are people's inhibitions lowered?
I never heard that saying, but I'm going to teach it to my children today. It's highly imprecise and imperfect. But essentially, yeah, the longer into the night, the more drinking, the more people drink, the less compliant they are with the rules. We've heard from folks that, people get more belligerent later in the night after a lot of drinking around, mask wearing and rule following. So we just picked 11.
Governor, could you just clarify National Grid? Were those people or customers without power? The numbers you gave.
Customers, 150,000.
150,000 customers in each house is a customer. So we're really talking about hundreds of thousands of Rhode Islanders without power.
Yes. Like my house is a household of 4.
Is one, but there's 4
Right,
people inside.
exactly.
Okay. I just wanted to-
Yes, exactly. All right. Thank you, guys.